So I'm Dr. Dave Lenihan. I'm the CEO of Tiber Health, which is the parent company of Ponce Health Sciences University. And we're in our St. Louis campus looking at the Sims with Oliver, coordinator of Sim Labs. All right, fantastic. Sims are amazing. I've been working with Sims for about 20 years now when the Harveys were first coming out. And got all types of stories on it. Tell us a little bit about this Sim. And one of the things I noticed when we walked in was it was blinking. It just blinked. What are the characteristics that a sim has and that Ponce is able to utilize in their education?
Yeah, for sure. So first off, we have a lot of generations of simulators. So we have some of the older generations. This is one of our newest generations. So you can see the fidelity involved in it already. You mentioned it. It blinks. They can breathe. They can sweat. They can cry.
They sweat.
They sweat.
Actually, you can feel perspiration.
Yes. Yeah.
No.
You can sweat. We can make them bleed or puke or
I didn't know that.
We can put fluids into them, take fluids out of them.
And does the physiology react by the fluid you give? Like if you give too much, the pressure will go up and things like that?
Yes. So we are able to control all of those numbers. So we can control all of their vital signs. We can change their blood pressures. We can change their pulse rates. You can feel they have pretty tangible pulses. You can palpate all of these.
Yeah.
The radial ones, they've got their carotid. They have fetal pulses
really?
Here in the feet as well.
On both feet?
Yes.
Oh, wow.
Yeah, they're pretty strong. Sometimes our learners need the extra strength to be able to find them.
Yeah. But that's great for a student because they might know not exactly where to palpate. They got to get their location. And so you do it on the sim before you go do it and try to fumble around on a patient.
Exactly. And that's really the whole point of simulation and why we rely on it so heavily in our curriculum here at PHSU. For that exact reason, right? There's a lot of clinical skills that we need to train with our simulated patients before we do them on our real patients. One thing I always say, and it sounds really mean, but we can essentially make these simulators as sick as we need them to be, so that by the time a student gets to their clinical sites, they can say, oh my gosh, I've seen this scenario or this sickness 1,000 times in our sim lab. I know exactly how to
So a student walks in. Mm-hmm. You're obviously not standing there.
Correct.
You're behind the glass there.
Yes.
And so you're watching the student do whatever they do, and you can adjust the situation based on if the student's doing something wrong, give them the response appropriate to what a patient would be, right?
Exactly. Yes, our rooms are completely functional. So all of the equipment you see in these rooms, and every room in our sim lab is fully functional. It's exactly what they'll use in the hospital. So we try to immerse them as much as we can. So we control all the simulators from our control room, which is on the other side of this glass. We also have fisheye cameras that we can monitor from.
I like, by the way, as an administrator and as previous dean, I like the fisheye because now you can also have third-party external reviewers.
Exactly.
You can really get a good quality assessment of how the student does in the sim lab.
Yeah, it's a great feedback tool as well for students to debrief on their own encounters.
Oh, yeah.
With small groups, they can go through together, each student individually, or work through the simulation as a group, then watch the footage back and say, okay, what did we do in this situation? What could we have done in this situation? It's a really helpful feedback tool.
So if you're adjusting the physiology out there, then I guess the number of cases is unlimited.
Unlimited, yes.
Right?
These are completely clinically capable. We can program in any sort of physiology that we need.
And so if they have a heart murmur or things like that, you can have the sounds and mimic that stuff?
Yes. So there's, I can show you the inside of one of these
machines.
It's actually really cool.
Are we going to go see the inside of another one?
I can take you to the room right next door.
I didn't know it sweated. That's kind of cool.
So we can take this whole skin piece off.
Oh, yeah.
And we can pull this all the way back. And so you were asking about heart sounds and lung sounds. All of these spaces here are
the auscultation points.
On all of the auscultation points. So we can control all of those sounds. So we can add in murmurs or wheezing in the lungs, crackles in the lungs, different heart rhythms, all kinds of things like that.
Wow. And can you put fluid in there?
Mm-hmm. Yeah, so underneath this abdomen plate here, and these ports are all for quick draws or quick fluids.
Right.
Otherwise, underneath...
I've seen Sims for 20 years. I've never actually driven inside one.
Yeah, it's always really cool if you get
so you can do compressions too.
Compressions, absolutely, yeah. So this whole chest plate can come up. You can see this will give us realistic feedback.
So you get a good feel on the force because all new students crack a rib when they do their first one, right?
Exactly.
So now you can kind of practice that to help minimize
Yes. The other thing you talked about, very common mistakes. We can intubate these machines. One of the most common mistakes when students are
Getting in the
intubated for the
lungs.
first time, getting in the lungs, also cracking the teeth, right?
Yeah.
So all of these teeth are replaceable. We
No,
can
you can
chop
crack
these
the
pieces
teeth?
out. Yep, we can crack their teeth. In some regards, we can crack some of their bones if we need. But the anatomy is about as clinically realistic as it can be. Obviously, you see the
And so, like, what's the emotion of the student when they're first coming in? Are they nervous? Like, when they first come in and do this clinical experience? Because it almost is like real life.
Yeah. Nervous, yes, for sure. But we always want to make sure that they are feeling like they are in a safe place where they can make mistakes.
Yeah.
It's better that they make the mistakes down here
Right.
than
Upstairs.
out on
I
the
agree
floor.
with that.
So they're a little nervous, but once they get their hands on these machines, then they get really excited.
We seem to have different like races and colors of the Sims. Was that a strategic thought process when we were acquiring these, or
No, it was. We really wanted to make sure that our students were exposed to a diverse patient set. So not only do we have different races, different genders, we have different demographics as well. We have geriatric simulators, we have pediatric simulators, we have a newborn. We can do labor and delivery on one of our simulators. So giving
I wish I would have had that.
I know, I know. I hear that a lot from our faculty. They say, "Man, I wish we had these." Absolutely.
So how is this going to work? So this is not only the nursing students are also going to use the simulators and this as an experience, not just the medical students.
Exactly. In fact, these models here that we're seeing are actually designed for nursing.
Are they?
These are from a company called Laerdal. They're nursing and models. So these are built for clinical skill practice. So all the skills that nursing students need to train most are what these are built for. So these are great to work with our medical students, to work through their clinical reasoning, but really these are built for clinical skills.
And I think the great thing is the medical students and the nursing students are going to work together in the Sims in that interdisciplinary approach to healthcare. And that's one of the great things that really makes the school unique, I think, in the way we're doing that. Not only investing in these high fidelity simulators, but being able to utilize that education component together is really quite important. Actually, I don't know why I think this, but that perspiration thing is amazing to me. Like because that's a big deal. A lot of times when you go feel a patient, the clamminess, that's a sense that we don't teach in medical school. But when you actually feel that for the first time on a patient, that's a big. You're like, what is that? And now you can, hey, look at if you're feeling that, you got to look at the vascular system too and things like that.
Absolutely.
Wow.
Yeah, the fidelity of our simulations is something that we take very seriously. So we want to create as accurate presentation as we can.
You can do it. The thing is, I like is you have such a variety of cases you could do. You create the cases, or do we buy the cases, or do you create the cases?
So faculty writes all the cases, and then we will build.
So our faculty write the cases.
Correct. Yes, all of our clinical faculty, they write their own cases. One of the things our surgical faculty like to say is that common things occur commonly. So generally, with the level that our learners are still in their training, they're getting pretty basic simulations, but at that level in their training, it's exactly where they need to be. They can practice their clinical skills, their clinical reasoning. For nursing students, the clinical skills, this is what these are built for.
Yeah. And so they could draw blood too and things like that?
Yeah, these have vein systems that run through. So we can push IV fluids in, we can draw blood out. Anything we need to do with these, we can find a way to do.
Can you tap a central line?
Mm-hmm.
Wow.
I know.
That is amazing. The first time you do that, if everyone's so scared, right?
Yes.
To be able to do it in a sim.
Yes. And that's our goal, that by the time the students get to those real life clinical scenarios, they say, man, I've done this 100 times before. On a simulator, granted.
But still.
But
it's better than just do it until you feel a pop.
Exactly. Right. That's what this whole lab here on our campus is for, is to practice these skills in a safe, controlled environment. So by the time you are in the real world, you've done it.
Oh. And they can look in the eyes?
Yes. So these ones, we can replace these pupils. So we can make them more. We can, yes.
So different pathology in the back, the retina?
Yes. And we have some on the other side. Some of our older generation actually have reactive eyes in real time.
I knew that.
Yeah.
So, I'm sorry. You can replace the pupil so you can see like a retinopathy. You'll be able to see like diabetes and the spotting or things like that.
Yeah. I have a whole box of little different.
In all fairness, it was about 5 years before I actually saw anything in the back of the eye. Everyone's like, "Oh, you see that?" And you're kind of as a medical student, like, "Yeah, I see it. Yeah, I got it." If I would have had something like this, I'd have known I saw nothing.
Yeah, we have another trainer that's designed just for
Eyes.
eyes. So they have little projector screens in the back of each eye, so we can program in whatever we need.
We have projection screens in the back of the eye.
We have 2 little projection screens in the back of the eye. We have about 60 different pathologies we can program in.
Really?
Yeah.
Wow.
It never ceases to amaze me how quickly the tech advances.
Right.
This is only about a half a generation up from our last ones, and the fidelity of them is so much higher and so much greater. The simulations we can do with these are so much more involved and capable than we could have done a year or 2 years ago.
I'm glad we did this.
Yeah.
What do prospective students think when they come see this?
They love seeing this stuff. When we have campus open houses for prospective students or students who've been accepted, we always bring them down here to show them these simulators. This is one of the highlights of their of their encounter.
And they get to listen and and touch.
Yes, feeling the pulses is always something that really excites them.
I think the clamminess is
the clamminess for sure. Nursing students rely on simulation more than any other healthcare discipline. So we're building 2 new labs for our nursing students.
Yeah, I know that. It's on the other side of the building, right? Where it's all that construction.
Yeah, we're going to knock down some walls and build out that way. That'll be purely dedicated simulation space for our nursing students.
Wow. That's great. Fantastic. Thanks.
Awesome. Thank you, Doctor.
Hello.